All right. So, okay. So, should we begin? I'll
Yes.
wait until, okay. All right. It's recording also, just to let you know. Okay. So, yes. So, yes, let's begin.
Hello all, and welcome to our virtual event, which is March into Wellness. We are doing this virtual event through Zoom, and please bear with us when there's a lag or wait time between slides. Good afternoon. I am Rosalinda. I am one of the wellness case managers.
My name is Jamie. I am the Census Manager.
Okay. And I'm Gina, the Wellness Assistant Manager. Okay.
My name is Charles Whalen. I am the Wellness Case Manager.
The topics that we will cover today include overall information about the New York Indian Council, our services, health topics, which will include the colorectal colon cancer, diabetes, specifically gestational diabetes, obesity, physical activity, nutrition, hepatitis C, respiratory illnesses such as influenza, coronavirus. We'll also provide information on screening and testing. We'll also provide commonly asked questions or frequent asked questions for each of these health topics. Then we'll transition into information about the census. You'll also see a slide of each of our contact information, emails, and extensions as well. Lastly, you will see the last slides include resources of the organization's website where we pulled our information, where you can also access after the presentation. I would like to mention that you will see a link on our Facebook page for a poll. Please, we encourage you to take part in this poll, and we will randomly select multiple individuals to win prizes, those who participate in the poll. Again, it will be placed on our Facebook page after the presentation. To begin, I would like to give information about the New York Indian Council. It's a Title V Indian Health Service Program, an urban Indian health program that serves American Indian Alaskan Natives who are enrolled in federal or state recognized tribes. Also, we also enroll clients that are first or second degree descendant, which means their parent or grandparent are enrolled members of federal or state recognized tribes. The mission of the New York Indian Council is to promote the well-being of the American Indian community by providing wellness. We also have an employment service sector. For the wellness department, the services that we offer are case management. We help navigate the healthcare system within New York City. For example, if someone is in need of health insurance, we put you in contact with our partners to enroll you in their health plan. We have Native Support Group Talking Circle, where we help you recover from your drug addiction and or alcohol addiction. We also provide health education. We provide health education on various topics. We provide these education to help prevent our clients from acquiring certain complications. And also those who already are living with these complications, we provide you with guidelines on how to maintain an optimum healthy lifestyle. Our next topic will be colon cancer, also known as colorectal cancer. March is colorectal cancer or colon cancer awareness month. The New York Indian Council have worked with the American Indian Cancer Foundation. What is colon cancer? It's a disease in the large intestine, also known as the colon, as well as in the rectum. Most colon cancers start as small non-cancerous clumps of cells called polyps. Without treatment, these polyps may turn cancerous and spread throughout the whole colon or the whole large intestines. Some of the symptoms of this disease includes bleeding, infrequent bowel movement, also fatigue, weakness. What one can do to prevent of acquiring this illness One that is within your control is to quit smoking, eating more vegetables and fruits, control your weight. Also, one of the other symptoms or signs or symptoms of colon cancer is that you have substantial fat around the waist area. Of course, to one prevention, getting screened, exercise, being physically active, and limiting alcohol use. This next slide is a diagram from the American Indian Cancer Foundation, which is entitled, "Which Colorectal Cancer Screening is Right for Me?" This diagram makes it easy for any individual to identify which screening tool is much feasible for them. This provides 3 screening tools that provides very accurate test results. These are the stool test, also called a DNA stool test, the flexible sconoscopy, and colonoscopy. I will now turn the presentation over to Rosalinda.
Hello again. So as Gina had mentioned, it was Colorectal Cancer Awareness Month. It is also National Nutrition Month. And the first topic I will speak on is diabetes. There are 2 types of diabetes. Type 1, formerly called juvenile diabetes or insulin-dependent diabetes, usually diagnosed first in children, teenagers, or young adults. Treatment for type 1 diabetes includes taking insulin shots or using an insulin pump every day, testing blood sugar levels several times a day, making wise food choices, exercising regularly, and controlling blood pressure and cholesterol. The second type is type 2 diabetes, formerly called adult onset or non-insulin dependent diabetes. It is the most common form of diabetes. People can develop type 2 diabetes at any age, even during childhood. Being overweight and inactive increases the chances of developing type 2 diabetes. Treatment includes oral diabetes medications or insulin shots, testing blood sugar levels, making wise food choices, exercising regularly, and controlling blood pressure and cholesterol. When describing the 2 types of diabetes, you may have noticed that making wise food choices, exercising regularly, monitoring your blood pressure and cholesterol are key players in preventing or controlling diabetes. To prevent yourself from being diagnosed with type 2 diabetes, here are 2 sources that can help you. The first one is Group Lifestyle Balance, which is a 1-year program that provides education, encouragement, and tools necessary to help you reach your healthy lifestyle goals. The program is designed for non-diabetic overweight individuals age 18 and older who have pre-diabetes and/or the metabolic syndrome. The second program is the Native Lifestyle Balance. It is a online program that has 16 weekly schedules of skills and tools you can use to reach a healthy balance of weight and physical activity. Each session includes a coaching video with participant handouts. There are different ways to help manage your diabetes or prevent it. For instance, Joe from the diagram, he is working one-on-one with his medical providers so that he can get the medication and education he needs for his conditions. Joe is being responsible and practicing self-care. Another way to help you is by going digital using online apps that you can download to your phone, smartwatches, or tablet to help manage your weight, nutrition, and physical activity. One app you can download is My Net Diary, which guides your weight loss journey with accurate calorie counting, weight loss, forecasting, and personalized daily insights. I have also provided a My Plate to get a sense of what your plate can look like if you had diabetes. Using a 9-inch plate, 1/4 is filled with whole grains or starchy veggies. The other 1/4 is lean protein such as fish, beef, and so forth, and the other half is filled with non-starchy veggies. Try to incorporate water or skim milk when eating instead of soda or sugary drinks. Gestational diabetes is another topic I will speak on, and that is a type of diabetes that is first seen in pregnant women who did not have diabetes before she was pregnant. Often, gestational diabetes can be controlled through eating healthy foods and regular exercise. Sometimes a woman with gestational diabetes must also take insulin. Although gestational diabetes usually goes away after the baby is born, a woman has had gestational diabetes is more likely to develop type 2 diabetes later in life. Problems that may occur when having gestational diabetes is having an extra large baby, a C-section if diabetes is not controlled during pregnancy, high blood pressure, or low blood sugar. I have 5 tips for you if you have gestational diabetes. 1 is eating healthy foods. 2, exercising daily. 3, monitoring your blood sugar often. 4, take insulin if that is directed by your medical provider. And 5 is to get tested for diabetes after your pregnancy. The next topic we'll discuss is obesity. Obesity is a treatable disease that is a worldwide health concern associated with having an excess amount of body fat. A person with a body mass index over 30 is classified as being obese. Obesity can lead to type 2 diabetes, heart disease, and some cancers. A health diet and regular physical exercise can help people achieve and maintain a healthy weight, starting at an early age and continuing it throughout their life. If you look at the bottom left on the screen, you can see a little brown box, and that is the physical activity kit, or PAC. The physical activity kit is to increase physical activity. The kit can be used in schools, communities, work sites, Head Start programs, elderly centers, and youth programs. The goal of the kit is to increase the time American Indians and Alaskan Natives spend in medium to high physical activity for all ages across the lifespan. You have other ways to prevent obesity, and one is exercise. Exercise is important for your health, and you can exercise during this time. Since a lot of us are working from home or just being home, we can put in time to do some physical activity every day. You can do some jumping jacks, sit-ups, or push-ups that do not take so much space in your home. There's also a trend happening on social media that is C30 Do 30, which is recording yourself doing some type of exercise and tagging your family and friends to do the same. Another source to help get your heart pumping and body moving is Powwow Sweat. It is a program that features a series of workout videos that break down 6 traditional dances into step-by-step exercise routines. Also, don't forget that you can explore your parks in New York City, and remember to social distance yourself from others. The recommendation is 6 feet apart. Another way to prevent diabetes and obesity and type 2 diabetes is having good nutrition. Nutrition is a critical part of health and development. Better nutrition is related to improved infant, child, and maternal health, stronger immune systems, safer pregnancy and childbirth, lower risk of non-communicable diseases such as diabetes and cardiovascular disease, and longevity, or having a longer life. Here is a diagram for my native plate. Using a 9-inch plate, half of the plate is vegetables, 1/4 is starches or grains, and the rest of the plate is lean protein such as fish, chicken, beef, turkey, or other types of meats. Don't forget to add fruits and try to drink water when eating your meals. Limit your intake on soda or sugary drinks. Examples of grains can be like tortillas, buns, cornbread. Vegetables can be from zucchini, carrots, pumpkin, salad. And the protein can be beef from beef stew, egg whites, chicken, turkey bacon, or fish. And fruits could be strawberries, melon, watermelon, blueberries, etc. I have also provided some healthy cooking and baking substitutes, such as using apple butter or applesauce instead of cooking with butter, margarine, or oil. Thank you for listening, and now I'm going to pass it on to my coworker, Charles.
Hey everybody, going to talk to you a little bit about hepatitis C. So hepatitis C is a diagnosable and treatable disease of the liver. So the liver is a wedge-shaped organ located under your right rib cage. It weighs approximately 3 pounds. Like I said, hepatitis C is a diagnosable and treatable liver disease caused by viral hepatitis C virus, HCV. We know that functions of the liver are they make protein needed for blood clotting, they store vitamins and iron for glycogen. They metabolize sugar, protein, and fat to produce energy. It removes waste products and filters toxic substances from the blood. The liver has enzymes called LFTs. We know that 6% of all the patients have elevated enzymes. The most common causes are alcohol use, obesity, and hepatitis. Next slide, please. The inflammation of the liver is caused by other viruses. We've got hepatitis A, B, C, D, E, and G. All right, what we are dealing with is viral hepatitis, which is hepatitis C. Other infections, mononucleosis, chemicals, alcohol, acetaminophen, those inflame the liver. So we know that there are 3 types of hepatitis. Hepatitis A, which is not chronic or long-term, there is a vaccine available. Hepatitis B, chronic carrier state in 6% of those who are infected. There is a vaccine available. Hepatitis C, it's chronic in 85% of those who are infected. There is no vaccine available. One of the issues that we have is cirrhosis. So what is cirrhosis? Well, some of the complications are encephalopathy, an altered mental status, ascites, fluid in the abdomen, edema, fluid in the lower extremities, and spontaneous peritonitis, and that's spontaneous infection in the abdomen, coagulopathy, impaired blood clotting mechanism. Symptoms of acute hepatitis are mild hepatitis, malaise, jaundice, and abdominal pain. Severe hepatitis is all of the above, plus bleeding, fluid retention, and an altered mental status. Next slide, please. Hepatitis C transmission. It's primarily through infected blood exposure. Some researchers think that the hepatitis C virus can live several days outside the body. Tests have shown that it can actually live up to 3 weeks, 21 days outside of the body. So, please be aware of pricks and sticks and, sharp instruments, and please listen to this information. Do not share injection equipment if you are an IV drug user. If you have had a transfusion prior to 1992, these are some of the transmissions. 91 to 99% of patients using clotting factor prior to 1987 are positive. And there are occupational exposure for healthcare workers. And this is continued. Sharps instruments, people are very safe. You be safe as well. Infected mother to newborn, this is perinatal. Injection and transmission in Baltimore, after 1 year or less of injection, 60% of IV drug users were HCV positive. 54% of HCV infections in IV drug users who do not share syringes was attributable to cotton and cooker sharing. So they didn't actually share the syringes, they just shared the equipment. Transmission among IV drug users is dropping, probably from education and syringe exchange. We know that there is sexual transmission as well. Acute studies 17% with multiple and/or HCV infected partner. There's a higher rate in STD clinic patients, but it's not associated with anal receptive sex. There are low rates of transmission in monogamous heterosexual couples. Other modes of transmission: medical, transfusion, transplant, dialysis, or other hospital acquired. So that may be a pinprick, needle prick. Perinatal, 6% transmission. It's higher in HCV co-infected mothers, and that's 18%. C-sections can lower the rate. Tattoo, 12.6% positive due to shared ink. They didn't share needles, they shared ink. Piercing, acupuncture, and household, there is no risk if no blood exposure. Cocaine, snorting with blood on the equipment. So some of the samples of chronic hepatitis C patients were tested, and those tests were urine, semen, stool, vaginal secretions, and breast milk, which were all negative for the virus. Saliva was negative in this study, but not in other studies. And this is a Stanford study on hepatology. And the sites are above, right there on the slide. You can refer to it. It will be available to you. Next slide, please. So are there other risks? Well, what we know is at least 10% of the cases have no known risk factor. In other words, we don't know how 10% of these people who tested positive for Hep C acquired it. We don't know. But what we do know, it is not spread by sneezing, it's not spread by hugging, it's not spread by coughing, not spread by food or water, and it's not spread by sharing eating utensils or drinking glasses. And it's not spread through casual contact, something like sharing needles. What to do if I am HCV infected? Well, the bottom line is to prevent infection. So how do I prevent infection if I'm positive? I do not share syringes, cookers, water, cotton, or ties. Do not share straws used to sniff cocaine. Use latex condoms. Do not share razors, toothbrushes, or other personal items. Do not donate blood, body organs, tissue, or sperm. Cover cuts and sores on the skin. And tell your partner that you are HCV positive. Please, we're trying to stop the spread of this. And please, if you are engaged in any type of risky behaviors, please get tested. The standard tests today that we have for HCV are the ELISA, the enzyme immunoassay test, the PCR polymerase chain reaction test. And again, if you would like more information on getting tested for HCV or anything else, give us a call and hey, we can hook you up. And I will turn this over to my next speaker, Jamie. Thank you. Excuse me, this is Gina. I'm sorry, Gina.
No, that's quite fine. Thank you, Charles. Once again, my name is Gina, the Wellness Assistant, and I'll present on respiratory illness. The first I will present on is influenza, also known as the flu. American Indians and Alaskan Natives are more likely than other groups in the general U.S. population to get sicker from the flu, be hospitalized, and even die from flu-related complications. Possible causes are household crowding, a lack of sanitary services, and limited access to timely medical care due to living in remote areas. Influenza poses a much higher risk to certain populations or groups such as young children, pregnant women, and elders. It can cause certain health complications to worsen, such as diabetes, asthma, heart, and lung disease. Some of these signs and symptoms of the flu are fever or having chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches. The way one can prevent acquiring the illness is to receive the flu vaccination every flu season. The way you can stop the spread of the germs include covering your coughs and sneezes, which is covering your mouth and nose with the bend of your arm, not your hands. to avoid touching any objects which other people can touch. Also, speaking of your hands, please wash your hands often. And if you are sick, please stay home. There will be a link provided of where you can access your local clinic, medical facilities, or pharmacies to receive the flu vaccination. The next topic is COVID-19. COVID-19 is a new respiratory virus that has the potential to cause severe illness and pneumonia in some people. Some of the symptoms are similar to that of the flu, which include fever and cough. This one also has shortness of breath. How it can be spread? Through the air by coughing and sneezing. It can also be spread by close personal contact, touching hands, kissing, or shaking hands. Also, touching an object which can also inhabit the virus. So please remember to also disinfect doorknobs, also disinfect surfaces where many people are constantly touching. How you can prevent that, like I had stated, to wash hands very often. That's similar to the flu. Also disinfecting any doorknobs, surface areas where multiple people are touching. Avoid touching your eyes, nose, or mouth. Also, please avoid contact with people who seems to have signs and symptoms of this illness. Please cover your mouth and nose, similar to the flu, with the bend of your arms and not your hands. As stated by the governor of New York and the mayor of New York City, please stay at home if you don't feel well. And also practice social distancing. This next slide shows screening and testing. First, the screening, a resource you can go to receive information for screening for colorectal cancer through the CDC. Then you see the link right here provided, as well as the number you can call, 1-800-CDC-INFO, as well as there's a link where you can go to find a local clinic to be tested for hepatitis C, as well as to be tested for STDs such as HIV, gonorrhea, and chlamydia. Now I will transfer the presentation back to my coworker, Charles, who will do frequent asked questions.
Good morning, everybody. The first slide, please, Gina. So, have carbohydrates. Well, fruits, starchy vegetables, milk, yogurt, rice, cereals, bread, and other grains all have carbs and give you important nutrients. What causes obesity? Lack of physical activity, poor diet, and unhealthy eating habits. To prevent pulling your weight and limiting alcohol use. Can people with diabetes still have a family, career, and a full life? Yes. Many adults who were diagnosed with diabetes as children are able to thrive despite the ongoing challenges of living with diabetes. Well, what is hepatitis C? Hepatitis C is a liver infection caused by the hepatitis C virus. How is gestational diabetes treated? Gestational diabetes can usually be regulated by healthy eating habits and adequate exercise during pregnancy. Next slide, please. Frequently asked questions continued. What side effects can occur after getting a flu vaccine? While a flu vaccine cannot give you flu illness, there are different side effects that may be associated with getting a flu shot or a nasal spray flu vaccine. These side effects are mild and short-lasting, especially when compared to symptoms of bad case of flu. A flu shot. Viruses in a flu shot are killed, inactivated, so you cannot get flu from a flu shot. Some minor side effects that may occur are soreness, redness, and/or swelling where the shot was given, headache, low grade, fever, muscle aches, nausea, and fatigue. The nasal spray. The viruses in the nasal spray vaccine are weakened and do not cause severe symptoms often associated with influenza illness. In children, side effects from the nasal spray may include runny nose, wheezing, headache, vomiting, muscle aches, and fever, low grade. In adults, side effects from the nasal spray vaccine may include runny nose, headache, sore throat, and cough. Does the CDC recommend the use of face masks to prevent COVID-19? A CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory illnesses, including COVID-19. You should only wear a mask if a healthcare professional recommends it. A face mask should be used by people who have COVID-19 and are showing symptoms. This is to protect others from the risk of getting infected. The use of face masks also is crucial for health workers and other people who are taking care of someone infected with COVID-19 in close settings, such as at home or in a healthcare facility. Thank you for allowing me to respond to these frequently asked questions. If you have more, please feel free to contact us at our contact information as stated previously. Thank you, and I will turn this over to Jamie.
Good afternoon, everybody. Again, my name is Jamie, and I am the Census Manager for the IDC. So with that being said, if you have, thanks, Gina. If you have not already received, you should be receiving very, very shortly the 2020 census in the mail. I'm sure many people have already received it, and within that envelope, you will receive all of the guidelines to be able to partake in the 2020 census. That will all include the 1-800 number, the website, as well as information to be able to mail in your census update. Now, with that being said, the 2020 census will ask a series of questions about you and each individual who lives in your home. You do have to list some of your personal information, such as your address, your name. However, none of that information ever gets sold to any kind of third-party vendors and is solely and only used for the 2020 census. And the importance of the 2020 census is so that we could get a better demographic of who is living in what areas. Therefore, the community could help build as well as cater to some of your specific needs. And on this slide here, it is asking for your race, and if you're an American Indian or Alaska Native, you can put in your particular tribe, which we strongly suggest. That being said, again, keeping in mind that this will take no more than 10 minutes of your time. It's very quick, it's very brief, it's very easy. None of your information will be shared with anybody else. And again, it is very, very important for everybody to please complete the 2020 census. As always, should you have any questions, my email address will be provided at the end of this slide, and please feel free to reach out to me and I will be more than happy to get back to you with any help I can possibly provide. Thank you so much for listening, and I'm going to turn this over to Gina.
Okay, thank you, Jamie. As you can see on this slide, it provides each of the staff workers' email as well as extension. Please follow us on our social media, Facebook as well as Instagram, and you can see we have the telephone number to the right. If you would need further information about how to receive referrals for screening and tests, also information about census, please do not hesitate to reach out to us. As you can see, this slide is resources of resources. These are the major institutions or organizations that we've looked into to put together this presentation. Please, this will be provided to you at the end. This will be provided to you on Facebook, which you can access and go through the slides one more time, and also have access to these links where you feel free to explore the websites as well as to obtain more information about each topic discussed. This is a further resource slide that goes more into details about the health topics. Please do not hesitate to reach out to us if you need further information or you would like further resources. With that said, I would like to end our presentation. Thank you so much to my coworkers as well as to our viewers. Thank you and have a great day.